Hi, I'm Dave Nguyen, and in this episode, we're going to talk about chelation therapy, a treatment that helps people who have been poisoned by heavy metals. Before we get started, this video is for informational purposes only. It is not meant to diagnose or treat you. So please, talk to your physician before taking action on any information in this video. I am a cancer biologist, not a medical physician. Research from Dr. Jeffrey Nordella has shown that victims of the Porter Ranch gas blowout have high levels of lithium, uranium, and other heavy metals in their hair. Additionally, a study commissioned by the County of Los Angeles Department of Public Health found that inside some of the residences in Porter Ranch, these heavy metals were detected. A chelating agent is a chemical that binds to metals. The one that we'll be talking about today is called EDTA, which stands for ethylene diamine tetraacetic acid. It is also referred to as EDTA. Here is the structure of EDTA. Notice these red O's. These O's represent oxygen atoms. EDTA has 4 oxygen atoms that can have a negative charge, and these negative charges attract the positive charge of metal ions. EDTA is able to stabilize a metal ion, here represented by the letter M, because it has 4 negatively charged oxygens and 2 nitrogens that also stabilize the metal. EDTA treatment is done through transfusions intravenously, meaning they have to inject the solution into your bloodstream. Chelation therapy typically is done once per week for a period of up to 40 weeks or even longer. It depends on your needs and the plan of your primary care physician. Heavy metals such as lead are deposited inside of the bone. The point of chelation therapy is to get the lead out of the bone and into the circulatory system. Once it's in your circulatory system, it will flow to the kidneys, where it is filtered out of the blood into the urine so that it can be excreted out of the body in your urine. Having high amounts of metals in your system is correlated with having high rates of problems relating to your heart and your circulatory system. The next few slides come from this paper, which discusses the relationship between chelation therapy against lead and cadmium and its effect on improving the lives of patients. In 2012, a study called TACT, which stands for Trial to Assess Chelation Therapy, was a large-scale study in which people who had heavy metal toxicity were given EDTA, and then their healths were tracked for 60 months afterwards to see if receiving chelation therapy improved their outcomes. The blue line represents people who received chelation therapy, and the red line represents people who received a placebo. At 60 months after treatment, about 30% of people who received chelation therapy had negative events relating to the circulatory system, compared to about 35% of people who did not receive chelation therapy. The studies also specifically looked at people who are diabetic. Again, the blue line represents people who received EDTA chelation therapy, and the red line represents diabetic patients who did not receive chelation therapy. And even in diabetic patients, chelation therapy resulted in a dramatic reduction in negative events 60 months after therapy. In a study of Korean people who worked in battery manufacturing, scientists found that treatment with EDTA and another chelating agent known as DMSA were both effective in ridding the body of lead. However, interestingly, what they found was that EDTA was good at getting lead out of the bones and into the urine. But what they found was that the lead that came out of the bone ended up also being deposited into the soft tissue, and that once in the soft tissue, it's actually the chelating agent called DMSA that is better at getting lead out of soft tissue into the urine. A very interesting thing this study found was that if you gave the patients EDTA first and then DMSA, then the DMSA extracts a lot more lead out of the soft tissue after the EDTA had brought it out of the bone. In this study, EDTA was given intravenously into your bloodstream, while DMSA was given as an oral pill.